This is such a frequently asked allergy clinic question that I thought I would just sit down and make a video about it today. Allergic disease happens when your system reacts to harmless things like pollen or dust mite. Allergy shots, which is a type of allergen immunotherapy, works by actually giving your immune system small doses of exactly what you're allergic to. And over time, we increase your exposure to the amount that you're exposed to. And over time, you develop a tolerance to your allergen. On a molecular level, what happens is you actually develop what's called neutralizing antibodies that block your allergy antibodies that develop to the harmless things like pollens or dust mites. So allergen immunotherapy is unique in that it's actually disease modifying. We are treating the cause of your symptoms and not just merely treating symptoms with say a nasal steroid or an antihistamine. The indications for allergen immunotherapy include those who have allergic rhinoconjunctivitis with symptoms that are either not well controlled by medications, or if you want something more permanent and more definitive. It's also used for venom allergy. Actually, that's my favorite way to use allergen immunotherapy. And it's also very helpful if you have allergen triggered asthma. Logistically, how allergy shots work is that there's a build-up period. So in my clinic here, I do a 5-month-long weekly build-up. Then I do a few years of maintenance treatment. So I do 5 years of treatment total, starting with weekly injections for 5 months and then monthly injections for 5 years. Side effect wise, you get injected with your allergens, so the reactions tend to be allergic reactions. It can be anywhere from mild skin inflammation to anaphylaxis, and yes, there have been fatalities from allergen immunotherapy, although the risk is very, very low. There are certain medications where if you have anaphylaxis, they can actually interfere with treatment of anaphylaxis, so we like to know exactly what medications you're on. In pregnancy, I tend to modify the dose. Some other conditions like cardiorespiratory conditions, I also either modify the dose or I make sure that the cardiorespiratory status is optimized until before I start allergy immunotherapy. And I live and practice in Canada, so there's a cost to it. In Canada, generally pharmacies sell allergen immunotherapy injections. So that's one type of immunotherapy for allergic disease. There's another one called sublingual immunotherapy, which I'm going to talk about next. Mary Jamie, allergist and immunologist in Ontario, Canada.